Hey Rachel, how are you?
I'm good. How are you? How you
I'm
doing?
I'm good. It's been a day.
Okay. It's been a day. I hear that. I definitely hear that.
For the sake of the
So,
people that already joined in, why don't you introduce yourself and we'll start.
so my name is Rachel Weinstein, and I am a social worker licensed in Illinois and in Israel. And I work with the elderly. I work with people regarding things about things focused around age and aging and illness and death and dying and things of that nature. I also work with people who are dealing with depression, anxiety, transitional issues, people who are um, dealing with either coming out or having someone in their family who is LGBTQ. And I work out of my little bitty office in Beit Shemesh and on Zoom. So,
Awesome. Awesome. And my
yeah.
name is Mirit Hoffman. I'm an elder law lawyer and a gerontologist. And my focus is estate planning, which means preparing wills and enduring power of attorneys and dealing with guardianship if needed, and also dealing with second and third relationships, prenups, and stuff like that, which is always fun. And I have a Spotify called Golden Topics, and today we are talking. Rachel and I have a podcast series called Caring for an Aging Parent, and today is our sixth session together.
Wow. Pretty
Impressive,
wild.
right?
Pretty wild. That's pretty wild. Yeah. Wow. 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 So.
Okay, so Rachel, why don't you tell us what are we going to talk about today?
So today we're going to talk about when mom or dad or whoever you're caring for, an elder, needs a psychiatrist, right? Does dad need a psychiatrist? And so I want to give you a couple of odd scenarios. Hopefully that'll make sense in a minute. And I just want you to think about the logic or the illogic, if you will, in them. So imagine trying to sweep your entire house with a straw, whatever that means to you. Just imagine a straw that you put in soda, you're trying to sweep with it. What about mopping your house with a hairbrush? Doesn't matter what the bristles are made out of. Or eating with a toothpick. Now, maybe the eating with a toothpick is a little bit more, a little less of an odd kind of thing. But the truth is, you could stab your food. You could, but maybe just get a fork and a knife. And especially, if you have soup, maybe get a spoon, right? There are things that you can do, but they don't always have to be so difficult. You don't have to make life that much harder. Life can get hard all on its own. We don't need to help it. And so the reason I use these as examples, even though of course they sound absurd, is because when somebody needs a psychiatrist, when mom or dad needs a psychiatrist, sometimes people get very apprehensive. She's not crazy, she's just old. Okay. No one is saying that anyone is crazy. Or you know what? She's just having a hard time. She's getting older. Like people who get older, they lose their minds a little bit. That's just normal. But it's not. But it's not. Going to a psychiatrist is a sign of weakness. My mom was strong. My dad could build a house with his bare hands. Not let me interrupt myself. Going to a psychiatrist does not negate that mom or dad were amazing at their jobs, were strong, were independent, are wonderful people. And it certainly doesn't mean that they're crazy. It means that there may be something going on that someone needs to evaluate, that someone needs to help them with, right? You don't have to eat with a toothpick. You can actually go and get a fork. What a concept. So it's not, even though there is stigma attached, and there's stigma attached to psychiatry and mental health and all of that, it there doesn't need to be. And if someone is towards the end of their life, that doesn't mean that they may not have a mental health issue. And why shouldn't we treat that? Why shouldn't we give them quality of life? So I kind of alluded to this before, but people will sometimes say, oh, they forget things, they lose things, they get a little angry sometimes, they get frustrated. She's just getting old. What can you do? Well, those are not, generally speaking, normal. Those are things that can often be in context and altogether a sign that something's not 100% right. It's not. because just because we're used to certain diagnoses doesn't mean they're normal. Oh, everyone forgets, everyone gets dementia. No, dementia is a brain illness, it's a brain disease. And once you've got the word disease, that takes out the normal. There are things that happen, there are certain populations that are more prone to certain things, but becoming becoming demented or losing your memory or your mind does not is not a normal thing, and it should be treated to help people with quality of life. um, Sometimes the older generation doesn't think there's anything wrong. It's all normal. Sometimes they think everything's a problem. So there's always moderation. There's always moderation. So the risks of not going to a psychiatrist, right? Even with all the, especially I should say, with all the fears, does this mean she's crazy? I've heard people say, is this going to be in like her permanent medical record? Like it's not, we're not applying to college. And it's okay, even if it was earlier, it's okay if it's part of her medical record. Um, the risks of not going to a psychiatrist take all of the issues and problems that mom or dad may be facing and make them even more complicated. They can be in more distress, right? If dad is screaming at people, and he was never the kind of guy to do that. Well, if he's screaming, that means something's wrong. Imagine not treating him. Now there's more wrong for a longer amount of time. And you know what? He's going to act out even more. So you're not doing any favors by by not getting him an evaluation. Also, if people are acting out, they're really angry, they're not aware of their footing or the area around them, they're not going to be as sharp as they need to be to prevent injury. Oh, look, mom walked into the wall. I wonder what. Maybe she was really confused. Maybe she needed an evaluation. Also, sometimes these types of behaviors can be the result of a medical illness. So even maybe before to a psychiatrist, make sure that mom and dad's medical chart, is up to date, that their lab work is up to date. Sometimes it can be, I don't want to minimize, but it can be something as simple as a urinary tract infection. I think I told you this once before that there was a gentleman, a lovely older man in a nursing home I worked in Skokie, and he really just a nice man. Hello, how are you? Polite, all of that. And then there was a couple of days, where he was really acting out. Like, it's not like him. And we knew it was significant when he dropped his pants in public. That was definitely not par for the course. And so the doctor ordered a urine sample. They tested his urine, and he had a urinary tract infection. Once he was on antibiotics, that lovely personality came right back because he was treated. At least, it was being addressed. But it was still of note that there were psychiatric behaviors, even though the cause was not psychiatric. So overall health, the point is overall health, right? We're not just our head, we're not just, from the neck down, we're a whole person. And so what happens below the neck affects above the neck and vice versa. We're one one being, not just parts. Um, the Sorry, I just lost my train of thought here for a second. Also, not admitting that there's a problem if mom or dad, let's say it's not just a UTI, not admitting there's a problem takes away quality of life. Why would any of us want to take away quality of life from someone we really love? It doesn't matter that it's something that we don't think is worth it. Who cares? It's not about us. In this particular moment, it's not about us. It's about how they live and how they enjoy their lives. Right? So, oh, she'll be a little upset. Do you want to be a little upset? I don't want to be a little upset. I'd rather be a little happy, not a little upset. So if that's a benefit that a younger person is allowed to have, why can't our elders? Why would we? Why wouldn't we? Do you want to give any questions for me so far? Or should I keep
I
going?
was just thinking that it's the whole stigma is more from our end, meaning the children or the people that don't want to take care of the issue, and less from the person who's actually suffering, who doesn't know there's stigma, not stigma. They're just not there at this
Right,
point. They're not
right.
behaving as they normally do. So you're not
Hmm.
really doing them a favor, and you're not really doing yourself a favor, because stigma, nobody really, nobody cares. It really
Nobody
should
cares.
be about you and the family, what's best for the person that is in front of you that you're either taking care of or that is your loved one, that
Right.
should be your main focus, not stigma and not how other people will see it.
Right. Also, you don't need to tell anybody else. And I'm sure you've heard a friend of mine said there's this the phrase is said this way because nothing rhymes with husband, but happy wife, happy life. I've also heard happy spouse, happy house. So take that general idea. If mom is acting out and she's screaming, and maybe she hit the nurse, wow, mom isn't like that. And she's not happy, but we're not going to get her evaluated by the psychiatrist because she's not crazy. She's just mom. She's having a hard time. Okay, whatever the reason is, let's get evaluated. Maybe a certain type of medication, because I'm not a psychiatrist, so I can't diagnose or prescribe certainly. But if there's a medication there that can help her, we're not talking about just give a pill and everything disappears. We're talking about helping. We're talking about, again, increasing quality of life. If that's going to help mom, and the next time you see mom, or the next few days or weeks you see mom, she's a lot more pleasant. You're going to feel a lot more pleasant. Mom, you look great. You're feeling better. Are you feeling better? Yeah, yeah. Did you know that you were really angry? Maybe she does, maybe she doesn't. But she's back, hopefully, to at least close to where she was. It's a win-win across the board. Um, the other thing, and this is related to the elderly and not only the elderly, but mental health. It doesn't matter if you are 9 or if you're 109. It's important and it's necessary. And when we don't feel well in any part of our body, the rest of our body responds. The same way, I know it's trite, but the same way that if somebody had a broken foot, if somebody had a wound, an open, gaping wound, nobody would question taking 90-year-old grandpa to the doctor. Like, not taking him would be neglect, could even be abusive. Don't do that. So what if his emotions are so raw that he can't contain them? What if he's so distraught about, I don't know, most of his peers dying? Maybe he's a widower. Maybe he's really upset with the state of the world and feels like he can't do anything. Why would we not take care of him? It's not, I mean, I know we're adults and life's not fair, but that's really not fair. Why do that? Um, Certain things that people should be aware of in their elderly loved ones is the fact that they may be isolated from family members. If you see that their self care is declining, right? It's not always about someone in a nursing home. If they're not brushing their teeth or their dentures as much, if they've gained weight, lost weight, and I'm talking like dramatic amounts, if they're sleeping a lot, not sleeping enough, if they seem to be more tired or have lower energy, their physical health starts to decline. Yes, your physical health can indicate there's a mental health issue, a psychiatric issue. If their emotions go all over the place, up, down, and sideways, if they use more drugs or alcohol. I know we don't necessarily think of, elderly people as, getting drunk or high, but people are people. So if dad really liked his gin, and I'm talking, an okay, appropriate amount, he really liked his shot at 5 o'clock. I worked with someone who the doctor had prescribed I think it was a shot at 5 p.m. He was in a nursing home. He was also over 100 years old. The doctor said if he got to 100, having a shot at 5 p.m., he knows something we don't. Let him have the medic. Let him have his gin. But if that shot is becoming, half a bottle, that's important to notice. If they, do they smoke a little weed, right? Yes, elderly people do that too if they're smoking more or they're forgetting how much they smoke. Whatever it is, just be aware of changes. If they're smoking cigarette, more of those, right? If they're detached from reality, they have their thinking is confused, sleep problems, right? Change in personal routine, etc. So if there's really significant changes, it's really important to get in and say, let's evaluate the entire person, the entire picture. Um, Something that I think is also really, really key is that we come to look at our elders with a certain amount of expectations. They're my mom. She's my mom. She could do anything. She probably could at some point in her life. My dad is the strongest. And maybe he truly was at some point. But what if he's not now? What if she's not now? She can do it. I'm telling you, she's just holding out on us. Right, mom? You're holding out on us. You could do it. no, maybe mom is not where you remember her being. So again, it's we always, when we're providing care of any kind, we also really have to check ourselves. What's going on in my head? Where is this thought coming from? What's really going on here? Is it for me? Is it about them? What's going on? And the other thing that I think is important, and I don't like to talk in these types of terms so much, but ageism is a real thing. Whatever. What do you want? You're 86. You lived a good life. I actually watched a repeat of a show from a while ago earlier today, House, about a very sarcastic doctor who would never get away with that kind of treatment in real life. But one of the episodes was about a 70 plus year old man who I think, or a 60 plus year old man who needed a heart transplant. And the team, the commit, I'm aware it's Hollywood, but the transplant team debated whether a man who qualified as a senior citizen should get a heart. Now, I'm not saying that this is the same thing. I'm not. But who decides, quality of life? If you're a certain age, are you not allowed to live happily? Are you not allowed to live? Are you
Who
doomed
defines
to be
that
sad or
also?
depressed?
Also,
What?
who defines that? Absolutely, I
Right,
agree with you.
right, right. So those are all factors to be really, really aware of. And I'll just say this last part before I take a break. Um, I work with, I'll keep all the details obviously confidential, but I work with a young man whose mom is in a nursing facility in this country. And it is clear from the stress that he has been describing that she has needed a psychiatrist in the worst way. Just please get this woman evaluated because it's her behaviors were just, they were dangerous. It was just really, really kind of an accident waiting to happen. And some of those accidents did. All of the siblings were aware of the behaviors, but one said, no, can't take, you can't take mom to a psychiatrist. She's not crazy. That's for crazy people. That's what this particular sibling said. And the others were like, well, what would you like us to do? If she hits us again, if she throws a glass again, would you like us to catch it as she throws? Like, what would you like to do? And that sibling was very, very difficult to deal with until the others said, we have the same right in terms of responsibility and all of that. We're taking her to a psychiatrist. And wouldn't you know that the psychiatrist wrote this beautiful report, full report, talking about cognitive decline, talking about a specific type of dementia, talking about follow-up care, talking about all the things that mom needs to get to a place where she's not throwing cups and screaming at people, where they're not getting calls from the facility 100 times a day. The other two siblings said, we have to do something. So they did. They spent an exorbitant amount of money because they could have had a lower cost good psychiatrist with their coupa with their health clinic, but because there were so many difficulties, they went private. It was very expensive, but they got this beautiful report, and now there's medication in place. There's a mood stabilizer. Shocker, because mom's mood is not stable. It's stable. It's not fair to her. So they're going to start that medication through the facility. It doesn't mean that mom is going to be placid and just charming old mom, because apparently mom wasn't always, let's just say, not always so charming anyway. But wouldn't it be nice if she didn't feel so distressed that she didn't feel the need to smack people around? What a concept. It's only
Wow,
fair.
that's a crazy story. That's wow. Well,
They really, really, yeah.
I could tell
Mhm.
you that I saw one of the times that I went to pray in a synagogue that there was this old woman in a wheelchair. She obviously had a caregiver who was right there next to her, who was a very young girl. And suddenly, out of nowhere, she started screaming abusive, horrible, abusive language at this poor 20-year-old. And what was good was that her son quickly realized something was off and immediately took her out so that A, she doesn't embarrass herself really more than
Hmm.
is needed, and also doesn't embarrass obviously the caregiver.
Right.
And what we understood later was that her meds had been off for a while, and this was just a very big indication that something was so terrible that they really had to
Right.
just go and sort it out, which is also very common, by the way. Even when people do have some form of dementia or Alzheimer's, that they need to be on top of their medication because sometimes it
Hmm.
works, and sometimes it doesn't work, and people get more
Right.
confused or more violent or more, and it's not just
Right.
because of the illness, but because their meds
Right.
need to be
Right.
adapted.
And this actually was another factor in this woman's care. She had been on a medication. There are certain medications that they won't stop dementia from progressing, but they will stave it off. They'll kind of like buying a little bit more time. Again, quality of life, why not? But apparently, the she is too progressed for that medication. So rather than it helping her, it was actually contributing to some of the behaviors. So that's going to come down. A mood stabilizer, excuse me, is going to go up. Well, she's going to start on it, and now they at least have a better plan of where to go. I want to say also that when it comes to antidepressants, not everyone, or antidepressants or anti-anxiety or mood stabilizers, whatever they are, not everyone feels the stigma. There are people who've been on these medications for years and years, and it's been really helpful and beneficial and all of that. But again, there's something about different phases of our lives. Certain medications will work better even if we've been on them for however long. There's a reason why, if you look on most medications, dosage from babies to this age, from 6 to 12, because our bodies metabolize things differently in different ways at different times, rather. So if somebody is on a psychiatric medication, a psychotropic medication, and you've really been on top of it with mom or dad, but now the behaviors are all starting to happen. I cannot stress this enough. Please do not play doctor. Please don't play doctor. Do not take your parents or anyone you care about and love, don't take them off a medication suddenly. I know. I know. No, you don't. You got to go to the doctor. Also, something that I've been hearing a lot lately is, well, I spoke to my friend. Unless your friend is a geriatrician or a qualified doctor, I hope that you have a wonderful friendship. They're not the doctor. Don't ask the friend. It's kind of like, well, I Googled it, I did research. I can Google too, but that doesn't make me a doctor. I'm not saying don't educate yourself. Yeah, you should educate yourself, but there is a reason we go to people deemed the experts, right? I don't get, I don't get my eyes checked by my neighbor who happens to wear glasses. That's absurd, right? The same way you wouldn't go to the person next door who has really beautiful teeth to check your teeth. Like, are you a dentist? Why would you do that? Don't do that when it comes to these medications, because if you stop the medication suddenly, you can actually cause significant, bigger and more pressing issues and more behavior changes. And why build that up in a person's body if it's already being built and there's maybe something else that needs to be done that the doctor who studied this for many years actually knows how to address. So please don't play doctor, even if your heart is in the right place. Speak to your friends, but not for medical recommendations. Oh, I met with an older person this week. I spoke to my friend. She was also on vitamin whatever, and she said she really had a lot of pain in her side when she took it. You're not the same body, though. You may both be on calcium, but that doesn't mean your bones are the same or your anything's the same. Be really, really mindful of it.
That's a very good point. That's a really good point. A lot of people do exactly what you just said. They have a somebody who knows of a somebody who had the same issue. It might be the same, exactly the same thing.
Right, right. But they're 10 years younger or older. They're not the same gender. They live in a different climate, but we're exactly the same because we're friends. But you're not. That's not how it goes. We all handle things differently. We're individuals. That's also why, look, a psychiatrist isn't going to prescribe the same antidepressant or anxiety or whatever it is to everyone who deals with that issue. There are different medications on the market. Why? Because different people have different needs. And one medication can work for someone amazingly. I've seen it like, wow, it's like somebody turned the lights on. And for someone else, it can make them so much worse. It's not cookie cutter. It's just not. Um, the message I would say I would want to leave people with is to be aware that if there's a behavior, if there's any need for psychiatric care, and the psychiatrist might say, you know what, this is a different issue. Call someone else in. That's what a responsible doctor would do. Please really think about that. Anyone who is acting out in any of the ways I just described, stripping in public. The little old man in the nursing home in Skokie that was not his profession. That was a sign of a maladaptive behavior. If people are acting differently, if they're calling out, they're yelling out, they're calling their nurse 100 times an hour, they're screaming, 100 times, whatever. Understand that as difficult as it is to hear and to see, I did not it was not easy for me when I saw my mom in the hospital before she went back to a nursing home, bellowing my name over and over and over again because she thought she heard me. She did, but hearing my name repeated that many times was a little dysregulating. As difficult as it is for us, the person who is doing the yelling, the calling out, the crying, whatever it is, they are telling you as clearly as they can that they are in distress. They're hurting. Something is so off within them that the only way they can communicate that is by acting out. So it's not just get it together. It's not, come on, mom, you know how to act in public. But not now, I don't, because something is off in my body and I don't know how else to tell you. So I'm going to call your name so many times that the people in the next hospital will hear me, but I'll get what I need. I'll get what I need. Even if you don't think it's major, and what I really need is for you to hold my hand and say, I'm here. You're good. I'm here. I'm here. And that's what happened with my mom. It wasn't a medication issue. She was terrified. She was absolutely terrified. And when I went to the bathroom, which you're allowed to do when you're visiting your elderly loved ones, my name got called a few more times. And, you can only do what you can do, but she just needed the reassurance. When I noticed, though, that it was happening more and more, yeah, then we did bring in medication because I couldn't be there every minute of every day.
Right.
So,
I think it's really, it's a really important subject. I think people don't want to face it because it
mhm,
scares them more than anything else. And
right.
there's a lot of
It reminds us,
stigma involved also.
it re- reminds us also of our own mortality. That's a fun topic.
Absolutely.
It's not
Absolutely.
fun.
Absolutely. And by the way, just as a side thing, because this podcast is not about this, but there is the enduring power of attorney, which deals exactly with these sort of issues of what happens when one is no longer capable of making his own decisions, who will make the decisions, what kinds of decisions, how they will make the decisions. All these things are sort of,
Absolutely.
put in on paper exactly for the person who's supposed to take care of them, so they know what
Right.
needs to be done. Just
Right.
as another
Right.
addition for this.
Right.
Super important, Rachel. Wow. So, wow, Rachel, that was really informative, as always.
Thank you. Thank
And
you
a
very much.
delight to
Thank you
have a
very much.
discussion with you, as always.
Thank
If
you.
anybody has questions, how can they reach you?
Okay, so my phone number, my phone and WhatsApp are connected to 052-874-5589. And my email is rweinstein, RWEINSTEIN, MSW @gmail.com.
Perfect. Okay, guys. Well,
All right.
I hope this was very informative. Thank you so much, Rachel.
Mhm.
Thank you so much for
Thank
everybody
you.
else who is listening or watching this. Um, in the meantime, have a good night or wherever you are, or a good day, wherever you
Whatever time
are.
of day it is.
Exactly. Don't forget to share this with anyone that you think will benefit from it. And looking forward to seeing you all in our next in our next episode on caring for an aging parent. In the meantime, bye bye for
Yes. Bye bye.